We discussed earlier the reason why patients benefit from in vitro fertilization. The first one we have discussed is blockage of the tube, which is tubal factor. But today we'll be examining endometriosis. Endometriosis, we can define it as presence of endometrial tissue outside any part of the body. Why would the patient with endometriosis need in vitro fertilization? Now, women with endometriosis have reduced monthly fecundity rate, which is about 2 to 10%. That is ability for a woman to be pregnant and carry pregnancy to 10 in one cycles. What are the reasons why patients with endometriosis will find it difficult to get pregnant? One, at the level of the ovary. The ovary that normally produce egg, a patient with endometriosis will suffer from difficulty in ovulation, which refers to as anovulation. Luteinized or rupture follicle syndrome. The follicle will not rupture when needed. Prolactin are also released. Hormones that are responsible for production of eggs are also distorted. Lipolysis due to prostaglandin and oocyte maturation defects. Number 2, coital dysfunction. People with endometriosis tend to have pain during sexual intercourse, which we refer to as dyspareunia. This will cause reduced penetration and reduced coital frequency. Number 3, tubal function. There is complete alteration in tubal and the movement along the tube, which is called ciliary movement, caused by the production of prostaglandin. Impaired fimbrial oocyte pickup. The oocyte cannot pick up the fimbrial cannot pick up the oocytes effectively. The sperm function are also affected. That is number 4. Broken down by some things in the body which are called macrophages. Then inactivation by antibodies in the body. Number 5, there will be problem with implantation. People with endometriosis, the baby actually doesn't stay well. So the baby tends not to implant. So there's usually problem with implantation. And lastly, these patients that have endometriosis can also have issues with pregnancy, which we call early pregnancy failure. This will be lead to early abortion, and these are usually induced by prostaglandin. Laparoscopy treatment has been observed to improve pregnancy rate in patients with endometriosis. Intrauterine insemination is also better than trying to wait for pregnancy. And the last option is in vitro fertilization is a major therapeutic option for infertile patients with endometriosis, especially with those who had coexisting infertility or had done other treatments. In summary, endometriosis definitely will reduce conception. The options that are available is either to treat it laparoscopically, use laparoscopy to treat it, or the patient can benefit from intrauterine insemination, and lastly, the patient can benefit from IVF. My name is Dr. Ede Dukbolo Usazua, the Doctor of Hope.